Now, what type of person seeks out a hypnotist? Who is it that makes an appointment? Who benefits from clinical hypnosis? Well, hypnosis is probably most well known as an intervention for cigarette smokers. It's probably the most popular use of clinical hypnosis. Now, I'm a former smoker who actually smoked 3 packs of cigarettes a day, and I quit using clinical hypnosis. I've had tremendous business success working with smokers, and I enjoy this type of work. Remember, I said I wasn't going to shy away from the business aspect of it? Let me touch on you the potential that comes just from doing this type of work. But there are plenty of opportunities for you to work in other areas of clinical hypnosis. I want to share with you, though, some of the things that I do. And I charge $259 for 3 sessions. My first appointment is about an hour, maybe an hour and 15 minutes. The second and third sessions are about 30 minutes each. Now, let's talk about the business potential here. I live in a city that has about 500,000 people. And people who make an appointment for smoking cessation always pay the full fee, and they always pay it up front. I don't accept insurance or third-party payment. In fact, I've found that if people aren't willing to pay what they spend for a month worth of cigarettes for freedom from cigarettes, they're probably not going to make changes. But let's talk here about the business opportunity. About 30% of the people in my city of 500,000 smoke cigarettes. So the question is, can I find 10 people a week out of 200,000 who want me to help them quit smoking? The answer to that is yes, I can. I can find about 10 people a week who want me to help them quit smoking. Well, let's do the math here. 10 people a week at $259 equals $2,590 times 4 weeks. That's about $10,000 a month in potential income. No insurance, no paperwork, or very little paperwork. And hypnotists who I know have this type of business success. And by developing your sales and your marketing abilities, you too might be able to achieve this success. But in addition to smokers, people see a hypnotist for a variety of reasons. I happen to like working with smokers, but I also see a lot of clients for weight loss. I usually don't see people who need to lose 10 or 20 pounds, kind of vanity weight loss. What I usually work with are the morbidly obese, the people who for some reason have regained weight after bariatric surgery, or they've been ruled out as a candidate for surgery and have already failed every diet in the book. I found that people don't see the hypnotist as a first choice. I'm usually the last choice for a lot of these folks. And I enjoy working with them because for them it isn't about vanity, it's really about life and death. In my own life, I've suffered from the excruciating pain of arthritis. Some of you watching this video may have your own experiences with arthritis as well. I've actually had surgeries and fusion, and I've battled chronic pain throughout my life as a result. Some of you who know me years ago remember when I was walking with a cane on a regular basis. But in my own life, I found that by practicing these principles, I've recovered faster, I've used no medication, and that I enjoy life to its fullest, even on bad weather days. And so I really enjoy, probably again from my own personal experience, working with medical clients, pain control clients, and both clients in pre- and post-surgical recovery or preparation. Many hypnotists see clients with very serious health disorders, such as cancer, HIV, and diabetes. The research shows that methods of hypnosis can actually help people manage the difficulties of some of the symptoms associated with these diseases and actually help individuals to recover from the situational crises, the surgeries, and the difficulties that they experience related to other medical diagnoses. Hypnosis is used with cardiac patients to help them manage stress, to help them recover from surgery, and it's used as a tool with autoimmune disorders like RA, like fibromyalgia, and the research shows that some methods of hypnosis can actually even be beneficial to the allergy sufferer. Hypnosis is used in academic settings by counselors and professors to help enhance test-taking abilities. It can be used to help with test-taking anxiety. It can be used as a tool to help enhance the learning process and enhance recall. Many hypnotists, especially those who live in cities that are state capitals where there are a lot of board and entrance exams, or university cities, can build an entire career helping people to prepare for and pass academic tests, licensing exams, and entrance exams. Just recently, I worked with a stockbroker who, at 42, 43 years of age, was making a career change. He had been in an entirely different field and needed to pass the stockbroker licensing examination. I've worked with people to help them prepare for qualifications exams, students who need to perform academic levels, and many other individuals in this area. Hypnosis is also used by top athletes to enhance performance. I've had the opportunity to work with many professional athletes. I enjoy doing this and coaching them in the mental aspects of sports performance and helping them to achieve what really is their greatest level of performance is something that we can do with hypnosis. Hypnotists also work with individuals with symptoms of anxiety. They can be used, hypnosis can be used as a crisis response tool and to help people recover from the distressing thoughts, mental images, and cues associated with post-traumatic stress disorder. The military, in fact, a few years back, I used to spend a fair amount of time as a member of the European branch of the American Counseling Association in Europe. And a lot of those therapists, most of the therapists who were in Europe who were members, were associated with the military, with family services, social workers, psychologists, and almost every one of them was trained in hypnotherapy. Hypnosis can also be used to simply enhance personal performance and can be used by those who are life coaches. It can be used to help people who don't have psychiatric disorders and mental health needs to make new choices, to seek and find new opportunities, and to accept change. It can be a tool for ending situational depression rather than pathological depression, anxiety, and to stop unwanted or compulsive behaviors by instilling new sets of healthy behaviors. I'm a marriage and family therapist, and as a marriage and family therapist, I find that by teaching couples hypnotic communication, it opens the doorway to enhanced intimacy. Interestingly enough, hypnotic phenomena can be used to overcome a variety of sexual disorders and sexual difficulties, and is among the most effective treatments